Well, good afternoon. It's been weeks since we had to do the unthinkable. We had to put things on hold. We had to cope with a new normal. We had to make great personal sacrifices, and we did. Ontario stepped up. We threw everything we had at this virus. We mobilized 14.5 million people in the fight against this virus. And together, we're taking the legs out from under it. My friends, thanks to our collective efforts, today we're prepared to announce the details of the next stage of reopening the economy. We're getting thousands of people back to work. We've laid a solid foundation for our economic reopening and recovery. We have the framework. We have the workplace safety guidelines. We have the capacity in our healthcare system. And today, I'm ready to announce that this Saturday at 12:01 a.m., private parks and campgrounds, marinas and boat clubs, golf courses, and businesses that board animals will be allowed to open. And on Tuesday, May the 19th, we will enter the new stage, stage 1, in the reopening of our province. We can reopen retail stores with street entrants that are not located in shopping malls, with strict social distancing measures in place. Certain seasonal venues, including outdoor sports fields, tennis courts, and off-leash dog parks. Vets and other pet services, such as pet grooming by appointment only, animal shelters, household services, such as cleaning and maintenance, certain health and medical services, including scheduled surgeries and in-person counseling. We'll also lift the essential construction limits to allow all construction to resume. I want to be clear that businesses should open only if they are ready. I'll repeat that, only if they are ready. And we need to keep in mind that all of this is dependent on the numbers. The truth is, we can't fully predict where things will go. So we need to be ready to react if we see a sudden increase in cases. We cannot let our guard down now. We must watch the trends like a hawk. And we need to remember, as we ramp up more and more daily testing, as we get more and more people back to work, the risk of flare-ups is real. So we need to stay vigilant. We can't take our progress for granted. We can't ignore the health advice. We need to be ready to respond, and we will be ready. We have the capacity in our health system. We have the testing and tracing systems in place, and we will be ready to respond to any flare-ups. My friends, today's news is good news. Our efforts are paying off. And if we follow the medical advice, if we take our time and get it right, then we'll be able to open more businesses, get more people back to work. We have a long way to go. We have a long road to recovery. But let's take some time today and be grateful for how far we all have come. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier, for your leadership, and good afternoon, everyone. Because of the collective efforts of all Ontarians, we have made real and significant progress in our battle against COVID-19. The number of daily new cases is trending down. Our hospitals continue to maintain significant capacity. We are seeing an unmistakable decrease in the number of patients requiring ventilators or being admitted to intensive care units. A growing number of public health units are contacting 90% of new cases within 24 hours as the province deploys more resources to accelerate these efforts. And Ontario has become a leader in Canada in daily per capita testing, having achieved over 19,000 tests in one day last weekend. Our government now has the confidence to start planning for the gradual reopening of our province, while continuing to monitor for changes and trends over the coming days. To ensure these early steps are a success, It's never been more important for the public to continue to adhere to public health guidelines, including avoiding contact with others outside of your household and maintaining at least 2 meters between yourself and others. Where physical distancing is a challenge, please wear a face covering or cloth mask to help stop the spread and protect against an increase in new cases. By taking an incremental approach, by continuing to follow public health measures, we can ensure the safe start to reopening the province. Thank you, and I'm happy now to turn things over to Minister Phillips.
Thank you, Minister Elliott, and good afternoon. Almost 3 weeks ago, we announced a framework to reopen our province, which outlined the guiding principles for a gradual, 3-staged approach to reopening Ontario. We called it a roadmap. Today, that roadmap has led us to the first stop on our journey, and while it's not the last stop, it is an important one. We are at this important point in our journey because we have trusted each other. You have trusted us to follow the guidance and direction provided by our health and science experts. We have trusted people to sensibly adhere to this guidance and direction. And as we prepare to step into stage 1, we must continue to work together and trust one another to proceed cautiously and adhere to the most up-to-date public health advice. The details we are providing for stage 1 will help people, including employees and employers, to be ready to take this critical next step by ensuring key public health measures and workplace safety guidelines are in place. In the coming days, you will hear about additional adjustments based on the evolving health situation, including on social gatherings, childcare, and education. As we continue to make progress, we'll monitor the public health measures necessary to move on to the next stage, and we'll announce more details on stage 2 and 3 based on best practices and lessons learned when the time is right. Our approach is informed by feedback we've received from people and employers in Ontario who've shared their ideas and concerns. And as we move forward, we'll seek even more advice to guide the critical work we are doing to map out our economic recovery. Turning on an economy isn't as easy as flipping a switch. This is new territory for all of us, and we are navigating it together. I am confident Ontario will emerge from this crisis with a clear path to economic recovery that keeps people safe and healthy. And to be clear, beating COVID-19 is critical to a strong economic recovery. I'll now turn it over to Minister Fedeli.
Thank you and good afternoon. I also want to thank the Premier for his continued leadership as we navigate through this crisis together. COVID-19 has confronted us with unprecedented challenges. Week by week and day by day, the response from Ontario's business community has been truly extraordinary. Today's announcement represents the next step forward in the gradual and safe reopening of our province, so more businesses and their employees can get back to work. Ontario's plan to restart the economy builds on our government's efforts to ensure the right tools and resources are in place to support our job creators while ensuring the safety of our frontline workers. This includes the Ontario Together portal and Ontario Together Fund to support businesses retooling their operations to help us source and manufacture much-needed critical equipment, supplies, and services. The COVID-19 Tackling the Barriers portal, which allows businesses to identify red tape and roadblocks that keep them from kickstarting their operations. And today, we are launching the Workplace PPE Supplier Directory. Through our consultations, we have learned that helping businesses find suppliers of personal protective equipment is essential to a successful reopening of our economy. Today, we are acting to make things a little easier on employers and also help them support other Ontario businesses. This PPE Supplier Directory is a new website that businesses can use to find suppliers of personal protective equipment. The website address is ontario.ca/PPE. This is just another example of our collective Ontario spirit. Ontario businesses helping Ontario businesses. More made in Ontario solutions. And it's an important part of our stage-by-stage approach to emerging from COVID-19 on a path to economic recovery. Together, we are working on a thoughtful, responsible approach to ensure Ontario emerges from COVID-19 outbreak and is on a path to economic recovery. Thank you, and now I'll turn it over to Minister McNaughton.
Well, good afternoon. As we carefully open businesses in villages, towns, and cities across Ontario, we know many things will be different, but this will remain the same. Your safety is our top priority. Ontario's labour laws are clear. Businesses must protect the health and safety of workers. That includes protecting them against workplace hazards, including infectious diseases like COVID-19. That is why we have hundreds of boots on the ground every day. Our inspectors are visiting workplaces to ensure everything is being done to keep workers safe. They are working with more employers to educate and help them in this new environment. We're helping you stay safe. Along with our health and safety partners, we have issued now more than 90 guidelines for different workplaces. They cover offices, healthcare settings, retail stores, construction sites, manufacturing plants, parks and campgrounds, and many, many more. We're also creating posters with good tips. The guidelines and posters are available at ontario.ca/COVID. We have doubled our phone lines so that workers who don't feel safe can report their concerns. In these times, we are all on the same side: employers, employees, and our government. Premier Ford and our entire government are doing everything we can to make you and your customers feel safe in the workplace. Businesses are stepping up to do the same. I encourage businesses to wait until they are absolutely ready before opening their doors. For all of us, safety should guide every decision we make. By working together, we will make our restart a success. Thank you.
We'll go to the phone line for questions. First question.
First question comes from Robert Benzie from the Toronto Star. Please go ahead.
Good afternoon, Premier.
Hi, Robert.
Does the first stage that starts Tuesday, does that last for just 2 weeks, so that if we have 2 weeks of good trends, then we go to stage 2 and more of the economy can open sort of the end of May?
No, we can't put a time frame, Robert, on stage 2. We're going to go strictly by the numbers. I think we've done a lot today, and I want to give a special thanks to the Chief Medical Officer to allow us to move forward, and it was all based on the numbers coming down, and we have to see a trend for a couple of weeks, so there's no time frame on stage 2. We'll take as long as it takes to get the numbers down consistently over a couple of week period.
Now, there remains some confusion in cities like Toronto where you still have police and bylaw enforcement officers in city parks. By my reading of the stage 1 reopening, parks can reopen. That's correct, right? So are you going to sort of tell Mayor Tory and others to call off the dogs and maybe let people go to the park and just chill out and do their own thing?
Well, Robert, I never tell any mayor what to do. We always consult. And I have to tell you, Mayor Tory's been a great partner, a tremendous partner, actually, in consulting all the time on any issue. And we respect his decisions as he does with ours. So we're in constant communication on a daily basis with his office, and both myself and Mayor Tory together.
Next question.
Next question comes from Christina Tenaglia from CP24. Please go ahead.
Hi, Premier. Hi, everyone. Of course, there have been a lot of questions as to when some personal services reopen, hair salons, nail salons, people being able to get a massage or chiropractic. Where does that fit into the timeline? Do we not hit that until stage 2?
Well, again, it'll depend on the numbers. I can't give you a specific stage, be stage 2 or stage 3. And I hear it from everyone, Christina. Look at my hair. I look like a sheepdog right now. I think dog grooming, I should go there and get a little clip myself, because, everyone wants to go and get their hair done. And, I live with, I have 5 girls, manicure, pedicure, hairdressers. I hear it all the time. But we have to make sure safety comes first. and especially in those close quarters when you have a hairdresser or a barber right over top of you cutting your hair. We're going to have to hold off on that for a little while. And sorry, Christina, I know you probably want to go as well.
We've been making do with us folks on air. Thank you so much, Premier. My second question, of course, at what stage do you anticipate easing the emergency order that people can only meet in groups of 5 people max? And wondering where this all ties in terms of the stages in the school year.
It's all dependent on what the chief medical officer says, but I'm going to let a couple of ministers speak on this, so I'll pass it over to our finance minister to start off.
Thank you for that question. So today is about announcing that move into stage 1, again, subject to continued progress on the health front on Tuesday. There'll be announcements in the days ahead with regards to other important issues, including group size, childcare, education. We know there are a number of issues that are very important, but as the Premier said, our plan is to move forward in consultation and given the advice from our Chief Medical Officer, and also to communicate really clearly to Ontarians when those changes happen. So today is about the opportunity for some of those businesses to be able to operate safely, some of the services that we talked about to be able to be available, and we'll make further announcements as the Chief Medical Officer indicates it's appropriate.
Next question.
Next question comes from Travis Denrush from Global News. Please go ahead.
Hey there, Premier.
Hi,
and all the ministers. This seems like a very long list. I know you've been talking for weeks about how this is more like a dimmer switch and turning it up as opposed to a light switch, but certainly these are a lot of businesses. And I want to go back to Rob's question initially. What is the metric for rolling back these measures, and how long are you prepared to wait if we do see a spike in case numbers in order to roll back measures?
Well, we always go by the advice of the Chief Medical Officer and our health team, and as you can see, a lot of it's outdoor recreation, areas that they can practice social distancing, which is critical. So those are the parameters, and that's what we looked at. And there's a massive list, but keep in mind, Travis, the vast majority of the economy is still shut down. We're just slowly opening it up. And to answer your question regarding if we do see a spike, as we, I should say, as a province, increase testing, it's inevitable that you're going to see a spike in numbers, more people that we test, but we rely on the health experts to tell us when to go and when to pull back.
And this question might be for you or Minister McNaughton. We've seen significant stories from workers already complaining about the health and safety of their workplace. There are hundreds of thousands of workplaces that are now going to be reopened soon. How confident are you that you have enough inspectors needed to ensure that these businesses are following the guidelines?
Well, I'll pass it over to Minister McNaughton, but before I have him up here, Mr. McNaughton's done an incredible job in communication in all sectors, specifically the construction sector as well, and I'm so proud of the construction sector. As the essential service construction workers continued working, thank God there wasn't one case of COVID. So it says a lot about not only the construction trades, but also the construction companies. They're working hand in hand with each other. We ended up having a conference again this morning and speaking to them, but they've done an incredible job, and hopefully they can set the gold standard for construction industry right across our country. I'll pass it over to Minister McNaughton.
Well, thank you very much for that question. We are going to keep workers safe in workplaces across the province. We're going to spare no expense. During this COVID crisis, we've increased the number of inspectors. We have 500 boots on the ground across the province. During the COVID crisis, since March 23rd, we've done 7,000 workplace investigations. We've issued 3,000 orders, and we've had to close down 20 job sites. But I'm confident we're going to work every single day to protect the health and safety of every worker in this province.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Thank you very much for taking our questions. Premier, I know you've been asked this a couple of times by my colleagues regarding the metrics on rolling back, and understand it's obviously going to be very dependent on what Dr. Williams says.
Yes.
So, I mean, that being said, what is your message right now to Ontarians who are seeing all of these businesses and other services opening up, and they could be very, very, very excited about it, but how much are you emphasizing that they still have to abide by physical distancing rules? Otherwise, there's a possibility that you may have to step in and do something in terms of rollback that you obviously do not want to do.
Well, it's absolutely critical that we're vigilant as a province. Every single person in the province, and I know the province is a big area, and it's a little different across large urban centers versus rural settings. But it's critical, and I want to emphasize again: if businesses are not ready to open, do not open. But if you don't mind, why don't I pass this over to my Minister of Economic Development? He was instrumental in putting this plan together as well.
Thank you, Premier. To echo what the Premier said, this allows the retail sector to open should they decide to. They don't necessarily have to, but this opens the door to them physically. They can do it three ways. First of all, they can continue with an online presence. They can do curbside and pickup, continue to do it that way, or they can actually open their doors, but following a very tough set of guidelines in terms of following the 6 foot or the 2 meter distance. Basically, if you look on the website at ontario.ca/COVID, you'll see the guidelines are you can work with 2 people per 4 square meters, which is about 40 square feet. Those are the guidelines that are set out. So there are always the social distancing requirements that are absolutely necessary in these retail stores. Thank you.
And Premier, I understand that there is an education enhancement coming. I recognize that. But given the news that we're seeing out of Quebec around canceling schools for Montreal specifically, not necessarily province-wide, is that, in your mind, something that is going to happen specifically for Toronto? I mean, for families who are living in Toronto, should they expect that, there might be openings for the rest of the province, but not for Toronto at least?
Well, we're going to keep consistent with the messaging when it comes to opening right across the province, and nothing is more important than protecting our kids, our children in this province. I'd lay my life down for every single child. That is the number one priority with me and our government, is to protect our children, bar none, over anything.
Next question.
Next question comes from Adam Stanley from Sportnet. Please go ahead.
It's a question for the Premier as it relates to the golf industry. Do you view this as an opportunity for golf courses to be a leader in their respective communities, as in we've got this unique chance to actually be an open business and we want to do things the right way?
Yeah, I think the golf courses, we've talked to so many different golf courses across the province, and our MPPs have, and they're responsible. They want to be the leaders, and I always say they want to be the gold standard, and making sure that they're responsible when people go out and go golfing. I received a letter, someone dropped a letter off at my house saying, a lot of seniors like going golfing, and please, don't let them go golfing. Well, you got to use your best judgment. That's what I have to say with the person that dropped off that letter, and I respect that they dropped it off at my house, and they're concerned. Maybe they have a loved one, maybe it's her husband, maybe it's a son, someone, but they were very concerned about elderly people going to play golf, and it may not sound fair, but you have to use your best judgment when you go golfing, depending on your health as well.
Follow up?
No, we're good. Thank you.
Thank you.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Premier.
Hi, Laura.
I'm wondering, I know you were asked about increasing the number of people that you can see, about gatherings of more than 5, but I think that's what that's what a lot of Ontarians really want to know right now is when they can see their family, when they can see their friends again. Seeing as you have already said that you think it's okay for people to see immediate family, is that now more of a suggestion as opposed to a rule? Do you think that this can be loosened at all for people to be able to visit more broadly?
Well, if you don't mind, why don't I send this to the Minister of Health? The Minister is doing a great job sitting on the health table every single day, communicating every day with the Chief Medical Officer.
Well, we know that's one of the things that are most important to people, that they do want to be able to see their friends and family. And we are doing a lot of work at the command table in health on this particular issue. We're working with some of the modeling experts, some of the people who are very, very knowledgeable with respect to these types of pandemics and what's most appropriate. We've been talking about pooling or bubbling that has been happening in some other jurisdictions. So we don't have the final answer yet, but we are studying it very carefully because we know, especially with the warm, wet weather coming forward, that that's what people want to hear about. And the other issue, of course, that we're studying very carefully, because I know this is important for many people, is when they can get together for religious ceremonies and purposes. So we are taking all of those things into consideration and hope to have more information to share with you very soon.
Thank you. And Minister Elliott, while you're up there, I'll ask about the testing strategy that you announced today. Basically saying that people with symptoms will now be tested. I think a lot of people were surprised by that and thought Ontario wasn't doing this already. So can you respond to that and how much more broadly you think this will expand? How many more people will now be tested, and were they being turned away before, even if they had symptoms of COVID-19?
Well, we were doing testing before at the assessment centers, but it was really based on the judgment of the clinician that was in charge of the assessment center. So what we've done now, it's a transition in some ways, because we have virtually completed the testing of all long-term care residents and staff. We're now moving to other congregate settings such as retirement homes, group homes, shelters, but we also know that now we are opening up parts of the economy. We need to do more public surveillance testing to understand what effect are these openings having on the public. So we need to have that data. So now when people come to an assessment center and they are symptomatic, they will be able to receive the test. So it is more of an emphasis now on public testing, which we need to have so that we can understand what's happening in the community as we open up our economy.
Next question.
Next question comes from Emily Pelletier from LaDroit. Please go ahead.
Hi, just to follow up on my colleague just now, I'm not sure I understand why the requirement of showing symptoms in order to get tested wasn't official yet. You mentioned it in the beginning of, Premier Ford mentioned it in the beginning of April. How can you guarantee that no one was turned away from getting tested by their local public health office because it wasn't an official requirement?
I'll pass it back to the Minister.
Well, it was always up to the judgment of the clinician at the assessment center to determine whether a test was needed. In some cases, the recommendation was go home, self-isolate for 14 days. If your symptoms worsen, let us know, and you may need to come in for an assessment. But we didn't do it with every single person. We felt that it was important to leave that up to the judgment of the clinician. But it didn't say that we just said to people, go back and just carry on life as normal. Not at all. It was important for them to self-isolate, to monitor their conditions, and to stay in touch with the assessment center so that if their personal health worsened, then of course they would be able to go in for a test. Now we're saying that if people are symptomatic, that they will be able to get tested, because we do need to open it up more to community surveillance to understand exactly what's going on with the opening up gradually of our economy.
Follow-up?
Your government had promised a pay increase to some frontline healthcare workers, but today is payday for some of them. And for the healthcare workers I've spoken with, this raise hasn't made its way to their account yet. Do you have a date for them?
We're working on that right away because what we've found is that there were many groups that were included, of course, in the pandemic pay, but there are others who feel that they should have been included, and so we are continuing to hear from them. We want to make sure that we have a consolidated response, and then, of course, people will be paid. So that's the only reason why it hasn't happened yet, is that we want to make sure that we capture everyone who should be captured within this decision with respect to pandemic pay.
Next question.
Next question comes from Mark Douglas from 680 News. Please go ahead.
Thank you. Good afternoon, Premier and Ministers. A question to you first, Premier Ford. The document you folks sent out today, I don't see the word restaurant in there anywhere. Can you tell me, do restaurants have to wait until stage 2 or even stage 3 before they can reopen?
Yes, we're going to have to wait for the restaurants. I know it's an area that people want, especially restaurant owners, to open up. But again, we're going to have to get the approval off the Chief Medical Officer and the health team before we move forward into opening up restaurants.
And then to go back to a question that one of my colleagues was asking about, family gatherings and gatherings of more than 5. On Tuesday, I guess we all get to go shopping again, but I can't have my family over for a barbecue if there's going to be 6 or 7 people. Why can I go shopping but I can't see my family?
You know something, I get it. I really do. I understand the pain that you're going through, and for months, and I know I had one of my daughters over or 2, and I got in trouble for that, but for months we never saw them. And I understand the pain you're going through, your family's going through, and other families are going through. And I just ask, just hang in there, just a little bit longer, and we'll get through it. But I fully understand the concerns out there, and I appreciate the concerns.
Next question.
Next question comes from Allison Jones from the Canadian Press. Please go ahead.
Hi, Premier. In the stage 1 guidelines, it talks a lot about things that we'll need to keep making sure we're doing, including staying at home and staying away from others if you're feeling sick. So does that mean that the sick leave and sick note provisions that you enacted in March, are you guaranteeing that those will remain throughout all of the reopening stages?
Well, I believe they should. If someone's not feeling well, do not go to work. If you're showing symptoms, do not go to work. Do not, to be honest, you shouldn't even be outside if you're showing symptoms. I'd go to an assessment center and get tested. And depending on the test, I would self-isolate.
Follow up.
Those job protections, are you guaranteeing that they'll remain in place throughout all of these stages?
Through all the stages, they will stay in place. We're going to protect the employees of this province. It's absolutely critical. They have to take care of their health first, and work can come second, but health is a priority. Taking care of themselves, their families, and then their co-workers. If you're under the weather, you aren't feeling well, do not go to work.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hi, Premier.
Hi, Cynthia.
Experts tell me that it's almost inevitable that there is going to be some sort of a bump 2 weeks after the opening. Is that a big concern for you? And I believe Colin touched on this as well, but or maybe it was Travis, I'm sorry. But how much of a bump can you tolerate before going ahead more or maybe drawing back?
I think it's a concern for ourselves, the health table. It's a concern for everyone out there. We have to stay vigilant. We have to continue following the protocols the Chief Medical Officer has set forward. But absolutely. But the good news is, there's always some good news. We're ready. We're ready. Our hospitals are ready. The system is ready. And I want to thank the healthcare system. How far we have come. Sure, we have a long way to go still, Cynthia, but how far we've come from 8 weeks ago or 10 weeks ago, it's massive. And I congratulate all the frontline healthcare folks out there in the health table and the Minister Elliott everyone's been working around the clock. So they're doing a great job. But the people that have made it happen are the 14.5 million people of Ontario. They're outstanding. Without their support, this wouldn't have happened.
And Premier, what do you say to the experts, the epidemiologists, who believe that not enough testing has been done to get a proper baseline before we make this move on Tuesday?
Well, Cynthia, there's no one's been pushing testing more than I have, and thank goodness we're wrapping up all the testing of the frontline healthcare workers and long-term care and the patients. We said it would probably be over the weekend. They've really excelled it, and they're wrapping up right now. And then we're going to move on to other congregate living areas, and no matter if it's seniors' home or shelters, we're going to focus on that. And then, as the minister said, focus on the public as well. But we are going to be ramping up testing in a big way.
Last question.
Last question comes from Colin DeMello from CTV News. Please go ahead.
Hi, my first question is for the health minister. Minister Elliott, just on surgeries and medical procedures, can you clarify what will be available on May 19th? And when can other medical services, such as non-emergency dental care, when can that reopen?
Well, in terms of medical procedures and elective surgeries, that really depends on each individual hospital, that they have to supply their readiness assessment plan based on a number of factors. It has to be approved at the regional level before they will be able to proceed. So that's going to be different for every single hospital. But what we're also going to be allowing is when they are ready to start with those elective procedures, that they will also then be able to do the other work that needs to be done, the diagnostic work, x-rays and so on, and any rehab that might be involved with the recovery from surgery. So that is not expected that will start on May 19th, but the process has already begun with the readiness assessments, and we're very hopeful that they will be able to start with those scheduled procedures very soon.
Okay, thank you. And to the Premier, Premier, there's a lot that can happen between now and Tuesday. I know it's just next week, but there is a lot that can happen. Earlier this week, Dr. David Williams had said specifically that we are not there just yet. We're not at stage one. Why are you so confident that we will be meeting the threshold as of Tuesday?
Well, when you say I'm so confident, I'm always weary, Colin. There could be flare-ups, and that's why I mentioned in my speech, if the numbers change, then we're going to have to change. We have to read and react throughout this whole pandemic. That's what the public's been doing. That's what our government's been doing. But let's continue on, making sure we social distance and following the protocol, and let's hope the trend continues to go down. We saw some really positive numbers. One of the lower numbers that we've seen over the last couple of months, which is a good sign. But remember, we saw that last time. All of a sudden, it jumped up a little bit. But as we test more people, we're going to get more numbers. But it's follow the protocol. That's the most important thing. And let's just hope everything keeps going smooth the way it is. And again, we couldn't have done it without the people of Ontario. 14.5 million people. That's the reason we're able to open up on Tuesday. Everyone's adhering to the protocols.
Thank you.
Okay. Thank you, everyone.